Okay, so today we're diving into something that's super important, especially for women,
Hmm.
and that's cervical cancer screening.
Yeah.
Um,
Mm.
we've got some excerpts here from a document all about screening guidelines.
Okay.
And honestly, after looking this over, I feel like everyone should know this stuff.
Right.
It's empowering.
Absolutely.
So let's get right to it.
Okay.
This document really drove home the point that screening can actually save lives.
Yeah,
Like really, truly save lives, which is kind of amazing when you think about it.
it is.
So how is that even possible? What makes screening so powerful in that sense?
Well, the key here is early detection.
Okay.
Cervical cancer, you see, it often develops pretty slowly,
Hmm.
but if you're getting screened regularly,
Yeah.
we can catch those abnormal cell changes,
Okay.
before they even turn into cancer.
Gotcha.
So it's like having this early warning system in place.
Okay. I like that analogy. So what does this early warning system look like in real life? What kind of screenings are we talking about here?
Right, so the most common ones you'll come across are the pap smear and the HPV test.
I've heard of those.
Yeah. So with the pap smear, what they're doing is looking for any abnormal cells in the cervix.
Okay.
While the HPV test, that one checks for, certain types of the human papillomavirus.
Right. HPV.
HPV, exactly. But specifically the high-risk types that, are strongly linked to cervical cancer.
Makes sense.
Now, there are a few other methods out there, too, like visual inspection using acetic acid.
Okay.
But honestly, those aren't as common.
Gotcha. Any advice for first-timers out there to make the whole experience less, I don't know, scary?
Oh, absolutely. It's completely normal to feel a little apprehensive, especially the first time.
Yeah.
A good tip, talk to your doctor. Like, really talk to them beforehand about anything that's worrying you. Knowing what to expect can help a ton with the anxiety.
True.
No, and
Right.
don't underestimate deep breathing exercises.
Right.
Those can actually help you relax during the procedure itself.
Oh, that's smart.
And remember, it's quick.
Yeah.
And honestly, the potential benefits way, way outweigh any temporary discomfort.
I agree.
So try to keep that in mind.
Okay, so let's say one of these tests, it does come back and it shows something abnormal.
Mm-hmm.
What happens next?
Well, first things first, don't panic.
Easier said than done, I imagine.
I know, but seriously, an abnormal result doesn't automatically equal cancer.
Oh, okay.
It could just be indicating precancerous cells.
Precancerous.
Yeah, think of those like warning signs,
Hmm.
They're abnormal, but not full-blown cancer yet.
Okay.
And here's the amazing part.
Yeah.
Treating these precancerous cells is super effective.
Wow.
And it can actually prevent cancer from developing in the first place.
So it's like stopping cancer in its tracks.
Exactly. Early detection and intervention are like the dynamic duo.
They really are. I mean, the document mentions that regular screening reduces the risk of dying from cervical cancer by a lot, up to 80%.
It's incredible, right? And the document actually lays out 4 key benefits,
Hmm.
to really hammer this point home.
Okay, let's hear them.
The first one, catching cancer early. I think we've covered that pretty well, wouldn't you say?
Yeah, we've definitely touched on that one.
Good. So moving on to benefit number 2, reducing mortality.
Right, because we're finding it early.
Precisely. That early detection and treatment are absolutely critical.
Yeah.
It prevents the disease from reaching a life-threatening stage.
And of course, that leads right into the third benefit, which is a much higher survival rate, right?
You got it.
It's like if you do happen to have those abnormal cells, finding them early gives you the best chance at a full recovery.
Imagine someone who's really diligent about their screenings.
Hmm.
They might have precancerous cells detected, get treatment, and then go on to live a perfectly long and healthy life.
That's the dream, isn't it?
That's what we want for everyone.
Okay, so we've got catching it early, reducing mortality, increasing survival rates.
Yeah.
What's that fourth key benefit?
The fourth benefit is identifying HPV infections.
Right.
And knowing your HPV status is so crucial.
Why is that?
Well, think back to what we discussed earlier about HPV.
Okay.
Remember, most cervical cancers are caused by certain types of HPV. So if you know your status, you can take the right steps.
Like what kind of steps?
Well, it might mean more frequent monitoring, for example,
Okay.
or even having a conversation with your doctor about preventative measures.
Like the HPV vaccine.
Exactly. It's all about having the information you need to make good decisions.
Informed decisions about your health. Yeah.
Exactly.
The document really stresses regular screenings, starting at age 21.
Absolutely. And that's a good general guideline.
Right.
But remember, everyone's different.
Hmm.
Those recommendations can vary based on your individual circumstances, your medical history.
So it's best to talk to your doctor.
Always a good idea. Together, you can figure out the best screening schedule for you.
Great advice. So the big takeaway here, and I think we've said it a few times, but it bears repeating, regular cervical cancer screening. It's powerful stuff.
It really is.
It's about taking control, being proactive, and giving yourself the best chance at a long and healthy life.
Couldn't have said it better myself.
Now that you're armed with this knowledge, what's your next step?
Yeah, what are you going to do to take charge of your health?
Think about it.
It's worth it.
It really is.
It could save your life.
Absolutely.
It's that important.
That's all the time we have for this deep dive. Thanks for listening.
And stay healthy.
We'll see you next time.
Bye.
Bye.